Hello, everybody. Welcome to today's Intermountain Community COVID Update. We appreciate you joining us. With us today is Dr. Andy Pavilla. Dr. Pavia is Chief of Pediatric Infectious Diseases at the University of Utah Health and Director of Epidemiology at Intermountain Primary Children's Hospital. And it's been a while, Dr. Pavia, since we have talked, but there's a lot happening today, and we wanted to provide the community and media with an update. Today's discussion is going to be live streamed on the Intermountain Facebook page. So we welcome all those joining us on the Facebook page. And we invite everybody, if you have questions for Dr. Pavia, please put those into the chat and we'll make sure your questions are answered. As well with the media who are joining us today, we will make sure that all your questions are answered by Dr. Pavia. But let's go ahead and begin, Andy, and thank you again for joining us. We know how busy you are. Let's kind of reset and let's talk about where we are today in the process for vaccines being approved and available for children under the age of 5.
Well, we're almost there. So this morning, the FDA gave its authorization for 2 vaccines, the Pfizer and the Moderna, for children 6 months to 5 years old, which means that kids of any age are going to have access to 2 vaccines when the final steps are taken. And those 2 steps are going to happen pretty quickly. The ACIP, which is the sort of clinical advisory committee at CDC, is meeting this morning. And I've been listening in on those discussions. They're going to make a recommendation this afternoon. Based on what we've heard, it's going to be a very positive recommendation, but they'll provide us with some details about how to use the vaccine. The CDC director has to approve it, and then the vaccine will start to ship. So we expect the first doses to be available in Utah by the middle of the week.
And in terms of the logistics, what does that mean for parents in the community in terms of accessing and getting the vaccines for their kids?
So the health department, I think wisely, is going to really emphasize getting vaccine into the hands of pediatricians and family practitioners so that parents can get their kids vaccinated at places where they're used to getting them vaccinated. We'll also have vaccine available at a number of pharmacies that are willing to vaccinate children, and at the Salt Lake County Health Department, and probably some of the other county health departments. I think the first vaccine is going to be available Tuesday at Salt Lake County Health Department. At primary, we'll have it in our community pharmacy, certainly by Wednesday, depending on shipments. So what that means, I think, is for many parents, they'll want to make an appointment with their pediatrician to go and get vaccinated. But there are these other alternatives, particularly if you're really in a hurry to do it. You got that trip to grandma coming up and you really want that protection soon.
Yeah, as a pediatric expert, what does this milestone mean? This is the last group of individuals to finally be approved for the vaccine, these children ages 5 and under. But from a pediatric expert who's gone through this pandemic, what does this mean for this population, but in larger perspective for families and the community at large?
This is really a big step. We've had several months now in which there's been a lot of disease out there, and younger children have not had any vaccine availability to provide them protection. And this has caused a lot of heartache for parents. Their kids are being exposed in daycare. They have to avoid exposing elderly relatives. So I think for many parents, having the option to get your kids vaccinated is something that they've been eagerly waiting for. And it is, something that every parent has to decide for themselves. It's not going to be required at this point for anybody. And I think that it's a choice you want to make, in consultation with your healthcare provider. I'm going to tell you why, as a pediatrician, as an expert in COVID, that I think you should do it. I would vaccinate my grandkids if I had any, hint to my children. But I think it's really a decision that every parent needs to be able to make. And I want to try and provide you with some of the good information to make that decision.
Well, let's talk a little bit about that. And again, for everybody joining us, we are with Dr. Andy Pavilla, who is Chief of Pediatric Infectious Diseases at University of Utah Health and Director of Epidemiology at Intermountain Primary Children's Hospital, who's really been at the forefront of pediatric care during the COVID pandemic. And so again, we welcome those joining us on our Facebook page, as well as the media with us. And we invite you to submit your questions on chat, and we'll make sure Dr. Pavilla gets to those. But Dr. Pavilla, let's talk about it. A lot of questions from parents. What are you hearing from parents, and what do you want parents to know about vaccines for children under the age of 5?
So I think, as a parent, you first off, you want to try and figure out if your child needs the vaccine. What are the benefits of the vaccines? What are the risks of not getting the vaccine? And I want to show you some data on that, because many of you are sick of hearing me say that it's a myth that children don't get sick with COVID, because they do. We've seen it. It's been pretty tragic. And then the other thing that you want to understand is, what does it mean to get the vaccine? What side effects can I anticipate? Are there any serious adverse events that we're concerned about? And is it going to work? So I'll try and walk you through a little bit of that. Okay. And with everyone's patience, I'm going to show a couple of slides because, I'm an academic and I can't really talk without slides. But I think to hammer home the point of how much disease really does occur for children in that age group of 6 months to 4 years old, I want to share with you the slides that were shown this morning to the members of the ACIP. And this is from a colleague of ours, Catherine Fleming-Dutra. I'll give you the URL for these slides in a minute. So this shows the number of cases that are reported to CDC by age group for children. And if you look back to the left side of the slide, you see that early on, when there was a lot of disease in adults up through the first winter of COVID, children weren't as heavily affected. But that really began to change in the fall of last year when Delta came along. And you can see now that there's a pretty big peak for younger children. And with Omicron, it really hit kids hard. And in the red and in the gray, you can see children 1 to 4 and less than 1 year old. And you see this big peak represents a total of about 578,000 kids under 1 who've been diagnosed with COVID, and almost 2 million kids 1 to 4. So it's a lot of disease. But of course, not every case is diagnosed or reported. You don't always take your children into the doctor, or home tests aren't reported. So we want to look at the more serious outcomes, because if it's 2 days of fever at home, maybe that's a different decision than if it requires an emergency department visit. So here are numbers for the percent of all visits to the emergency departments in the areas of the US that are part of this surveillance system that were due to COVID for children. And you can see that during Omicron, about 15% of all visits of children to the emergency department were due to COVID. So this represented several million emergency department visits. And really, I think where the rubber meets the road is hospitalization. Luckily, not many children die of COVID, and I'll talk about that in a minute. But here are hospitalizations. And there was a huge upturn in hospitalizations this winter with Omicron, and we're seeing that going on still with this milder, but still pretty important summer surge that we're having. But the point that this slide makes really nicely is that once Omicron hit, it was actually kids 6 months to 4 years old who had the highest hospitalization rates. A lot of that was because we were now getting vaccine into the arms of our children who were 5 years of age and older, and protecting them. So deaths, fortunately, are not a huge part of the burden of COVID, but nothing kills a lot of children. Any death in a child is very significant. And I'm going to show you some comparisons of deaths from COVID compared to other vaccine preventable diseases. But let's just talk about some numbers. So in the age group for which vaccine is available, that's the 1 to 4 year olds now, there have been 202 confirmed deaths that are due to COVID. It's probably an undercount. There have been 210 deaths in infants 6 months and younger. These are the ones who are still too young to get the vaccine. But we do have a way of protecting them. And this is a little bit tangential, but really important. And that is that if a woman gets vaccinated during pregnancy, she passes antibodies through the placenta to her baby and provides some protection for the first 6 months of life. So even though these don't look like huge numbers, COVID is now the 4th leading cause of death for children less than 1, and the 5th leading cause of death for children 1 to 4. And I think the last thing you really want to think about is, well, I'm happy getting my child immunized to protect them from rotavirus or meningitis or influenza? And aren't these much worse than COVID? And the answer is no. COVID poses actually a much bigger risk to your child than any of the diseases that you routinely bring them in to get vaccinated for. So here are some numbers for deaths before vaccines came available for some of our common diseases for which we vaccinate. 3 deaths for hepatitis A, 8 for meningitis, one of our more feared diseases, 20 for rotavirus, compared to 86 over a similar time period for kids in this age group now. So it's not as if there are a huge number of deaths, but we vaccinate our kids to protect against much smaller risks than the risk that COVID poses. So I'll stop there. This is the URL for the slides that were presented this morning. They're in the public domain, and you may want to download them and look at them, and we can put that in the chat as well. And I will put my face back on the screen instead.
Well, thank you. Well, let's talk about what's been our experience so far. We have a couple things to talk about, but let's talk about the experience for kids between maybe 5 and 16 or 17 and 18. So that little older group. We've been vaccinating that group for a little while. What have you seen? What's your takeaway from the vaccine in those a little bit older children?
The uptake's been quite good for the teenagers, and Utah's actually a little bit ahead of the nation as a whole in immunizing teenagers. There are a lot of kids who still need to be immunized. We've got a ways to go for kids 5 to 11 in terms of getting them vaccinated, but we're again doing pretty well with that. Effectiveness studies, which we can do after the vaccines are licensed, have shown us that in the pediatric age groups, the vaccines work at least as well as they do in adults. Now, the big change, of course, has been that once Omicron appeared, that 2 doses of vaccine no longer provides great protection against all infection and all symptomatic disease. It's still pretty good protection against hospitalization, but to really get the best protection, you need 3 doses. And we've seen that pretty clearly with children. And we've only recently been able to give that booster dose to younger children. So, we're just now able to get that level of protection for them. So important take-home point is vaccines don't completely protect you from getting infected. I can attest to that. I've gotten infected myself, but they do provide very good protection against more severe disease. They reduce the number of emergency room visits a great deal more than they do any infection, and they reduce hospitalization still farther.
Yeah, the vaccine formula for these children 5 and younger, is it different than the regular dosage levels? Is it being formulated specifically for pediatric population?
Yeah, let's talk about the 2 vaccines because they're a little bit different. So Pfizer and Moderna both are going to be available, and they've taken slightly different approaches. So after doing dose ranging studies, Pfizer decided to go with a very low dose, 3 micrograms. It's 1/10 of the adult dose. And Moderna decided in the youngest age group to go with 1/4 of the adult dose, 25 micrograms. And that had some impact on how they worked and on side effects. So the Moderna vaccine produced very good antibody levels after the 2nd dose. And those antibody levels were as high as you would see in young adults after 2 doses. And young adults are kind of our gold standard because they respond very well to vaccines. The Pfizer vaccine with this very small dose did not get a very good antibody response after the 2nd dose. So they went on to study a 3rd dose. And after the 3rd dose, the antibody levels were as good or better than in young adults after 2 doses. So that's a big difference. And it translated out into a small difference in side effects. So both vaccines, and this is really important, we don't want to pretend that vaccines are without side effects. Both vaccines cause soreness at the injection site, sometimes redness, rarely swelling of the lymph nodes of the armpit or the groin, depending on whether the vaccine was given in the arm or the leg. But probably, as parents, what worries us most or what's most upsetting is when our kids get irritable or get fever. And there's a slight difference in the amount of fever. Roughly 7 or 8% of children getting the Pfizer after the 2nd dose had fever compared to about 15% with a Moderna vaccine. And that's probably because the bigger dose, you're getting a little more reactogenicity, a little more side effects, but a better immune response after that second dose. The other thing to know is, and people who've been vaccinated experience themselves, is that it's not uncommon for the side effects to be a little bit more bothersome after the second dose than the first.
Let's talk about what we're seeing here in Utah. We're in the middle of summer, and so a lot of people are outdoors. But in the numbers released this week by the Utah Department of Health and the Salt Lake County Department of Health, we're seeing a rise in the number of transmission cases. We're also seeing a number of deaths, and we're seeing hospitalizations. What are you seeing in the pediatric population among children with this rise in cases that we seem to be seeing in Utah right now?
So there's been a pretty big increase in the number of children who are being infected, whether you measure that by the percent of tests that are positive or the number of positive tests in the emergency department of primary children's. And we've had a moderate increase in the number of kids who are in the hospital. When we're at our lull in April, sort of our really good time when everything was looking good, we were having between 0 and 1 child in the hospital at any given time. Now we're seeing between 6 and 12 children in the hospital because of COVID at any given time. Now, the good news is that is far fewer than we saw in December and January, and we're not experiencing the kind of crush and bed shortage that we had back then. We're very busy, beds are tight, but this is not an overwhelming situation. And the number of hospitalizations is relatively modest compared to the amount of spread in the community. That's good news. And it's probably in large part because so many people have either been vaccinated or infected or both.
Okay, well, let's go to our questions from our Facebook viewers. We have a question asking about how long after receiving the full number of doses will a child be considered fully vaccinated? And let's talk about how many doses are going to be recommended for children, both those 5 and under and even 18 and under. What's the recommended frequency and dosage schedule?
So for kids 5 and up, now the recommendation is the full series consists of 2 priming doses and then a booster. So, and that's similar to adults. We really are looking at a 3-dose series to get full immunization. I think that, of course, the ink isn't dry on any of the documents yet, but when the recommendations come out tomorrow, they will probably say that it requires a 3-dose series to have protection from Pfizer, and a 2-dose will be authorized for Moderna. But I want to emphasize that Moderna also believes that 3 doses will give you optimal protection. They are going ahead with studies, and we think by late summer, there'll be a recommendation for a 3rd dose of Moderna as well. And perhaps because that gives a somewhat greater protection after the 2nd dose, you have a more protection between the time you get dose 2 and you're waiting for dose 3. But I think the downside is that, yes, this means 3 more injections, 3 more trips to the doctor for your child to get a complete series, or trip to the pharmacy or trip to the health department.
Thank you. A question from another Facebook viewer asking about natural immunity among children under 5 years of age. Do they have natural immunity? What's your thoughts on that question?
Sure. So one misconception when people say natural immunity is that it suggests that if you get infected, you have some kind of magical immunity that's better than vaccine. And the truth of the matter is that it depends on how sick you were, how old you are, which strain you got infected with, and how long it's been. So being infected does give you some protection. That protection fades with time. And if it was an older infection back in 2020 or 2021, it isn't going to protect you very well against the strains that are going around now. But it's kind of equivalent, the way I think about it, to 1 immunizing event, 1 dose of vaccine. What we know from a study that CDC did on of blood antibody levels is there's some evidence that at least 70% of children have seen the virus once. Now, there's a caveat about that study. That study was done with discarded blood samples from national labs. And children going to have their blood drawn are a small subset of kids. Those who are more likely to have perhaps chronic underlying conditions or having had their blood drawn because they were sick with COVID. So I think it's a little bit of an overestimate. Short answer is a lot of children have been infected. That will act as a prime and will improve their response to the vaccine, but it doesn't give them enough protection to skip the vaccine in my mind.
Very good, thank you. Jamie from the Standard Examiner asked, what are we thinking about for the fall and winter? We're in summer right now where there's a lot of outdoor activity, ventilation, but what about things coming up in the fall when the temperatures start to fall?
Well, predictions are always difficult, especially about the future, and it's never been more true than with COVID. However, we think that because immunity is fading with time and because spread is enhanced by being indoors, by having activities like school, daycare, when your parents are back at work full time, that it's highly likely that we'll see more disease spreading in either the fall or the winter. The other factor is the evolution of this virus. Every time we've turned around, it evolves to become more efficient at infecting us. And it's pretty likely, although we can't predict for certain, that by fall we'll be seeing variants that are still more able to infect us. So I anticipate a very busy fall.
Okay, Lisa from the Desert News asks, what does the CDC's high community level of COVID-19 in 5 Utah counties mean for children in those areas?
I hate to give long answers, but I will here. The community level is a measure that's really based on hospitalization rates and the percent of people going to emergency departments. So it tells you how much bad disease is there and how stressed is the healthcare system. The other measure is the transmission rate, and that's based on the percent of tests that are positive, the number of people are testing positive. All but about 3 counties in Utah are in the high transmission rate, but only 3 are in the high community level where the hospitals are being stressed and we're seeing a lot of emergency department visits. The CDC guidance says that if you're in the moderate or high community level, that it is time to begin masking indoors and taking other precautions because the healthcare system is beginning to be stressed and a lot of people are ending up in the hospital. But that said, when there's high transmission in your community, it means that there's a lot of sick people around you and your chances of getting infected are high, and reasonable precautions in high-risk settings like indoor crowded settings are still a really good idea.
Yeah, another question from a Facebook viewer. They had read that during the pandemic, a lot of the ongoing regular vaccines for kids, not COVID vaccines, but just other influenza and so forth vaccines had been missed. Where are we now coming at this point in the pandemic and coming out a little bit in terms of what you're feeling about where children in Utah are regarding overall their vaccine schedules and their protection levels?
Well, overall, we know that a lot of children fell behind on their vaccinations during the highest days of the pandemic. I don't want to say during the pandemic because we're not done.
Right.
And that, has created some vulnerability. If measles arrives in Utah, there are a lot more kids who are behind on getting their measles immunization, so it could spread more rapidly. It puts some stress on parents because now, not only do you have the vaccines that they're coming up for because of their age, but you may have some visits that you have to do catch up on. And I'd urge everybody to, check in with your provider's office and see where you stand. Take advantage of the summer and fall to get caught up. We've been really lucky with measles so far. There haven't been any measles outbreaks in the US, but as the immunization rates have fallen, we've been holding our breath. And today, a case was detected in Ohio, and I'm very worried about what's going to happen in those communities. I think there could be a lot of cases.
Yeah. Andy, we're going to be wrapping up here, but talk to parents of children under the age of 5. They have some concern. They're hearing that these vaccines are now available. They've been or will be approved shortly. as a pediatrician, as an infectious disease expert, and as somebody who's been on the front lines of this pandemic for over 2.5 years, what would you tell those parents? What's your advice in basic terms for parents who are now having to make that choice about, do I get my children vaccinated or don't I? What would you tell them?
The most important thing is to talk it over with somebody who really knows, and that really means your provider, not a friend on Facebook, not a Reddit thread, and think it through, because it's important that you make that decision for yourself. However, if you compare it to other things that we vaccinate our kids for, then the risk is higher and the vaccine is at least as safe, based on everything we know to date. So that, the same logic that makes you get your child vaccinated against measles or meningitis or pneumococcal disease would really urge you to get them vaccinated for COVID. But, this is not going to be all that easy. That means 3 visits over the next 6 months. That means your child's going to have a sore arm or a sore leg and maybe a fever. So I'm not minimizing that part of it, but the benefits are really big. The downsides are small, but they're real, but the benefits are large. And, as a parent, it would be a no-brainer for me if my kids weren't of an age where they made that decision for themselves now.
Yeah, we've seen in the pandemic pockets of areas of communities that have had some disparities in vaccinations, higher risk areas, underserved areas. So for parents in those communities, what would you say, who may even be more reticent just because of cultural, religious, or other barriers that may exist? Any thoughts on what they should know?
I think it's really important for people who are from communities of color or poor communities to realize that actually the disease has been much harder in your community. And I know that we have disparities in access of care in Utah that make it difficult. And because the impact of COVID has been harder on Black and Hispanic and Indigenous kids, it's all the more reason to get them protection. But it's also not going to be quite as easy, because compared to people on the east side, you may not have a pediatrician with an infinite number of visits available. And I know that the health department is going to work very hard to try and improve access to underserved communities. And so will the healthcare organizations like Intermountain and the university. So inform yourself, find out where you can do it. There are probably ways to do it, to get your child immunized without missing work, where you can do it with late hours or early hours. But please, don't compound the impact of COVID on your community by having your kids more vulnerable by not getting them vaccinated. And I will add, just for, it's always important to say that the studies did include children of color to a representative level. So it's not like this has all been tested on doctors' children, from upper class white America. Doctors aren't really upper class, middle class white America.
Okay, well, we're going to finish today's session. Andy, thank you so much for taking the time that you've taken today. Any last thoughts? I think we've covered a lot of the questions and concerns out there, and we'll follow closely the next steps from the FDA. But anything you'd want to leave us with?
Well, for a lot of parents, this is just a day they've been waiting for, or at least Wednesday will be a day they've been waiting for a long time. For others, I think they're going to need to think it through and get some information. But when they do, I think they will see the logic of getting their kids immunized and protecting them. And that's what we want for our children.
Very good. Thank you so much. We did have one request. Would you mind posting the link on your last slide? We did have some people who want to go to that link. And so with that, we'll remind everybody that for the reporters joining us on the call, we'll send out a recorded copy of today's session with Dr. Pavia. And for those joining us on Facebook, we'll also post this on our YouTube, Intermountain Healthcare YouTube page as well. And so we really do appreciate all of you joining us. And Dr. Pavia, again, thank you for your time. If you'll post that link, we'll have everybody go to there and they can get further information from the data that you shared. And with that, we'll depart. And thank you again for joining us. Have a good day.
And hopefully,
go
I'm
ahead, Andy.
showing is the final slide showing that has the URL.
Yes.
Great. You can, and for reporters who want to cover it in more depth, you can also listen to the recording of the entire session, and it's really fascinating. I'd really commend you to the first talk by Catherine Fleming Dutra.
Very good. I don't think your last slide, your last page is on there. I think we're seeing black here. There we go. There we go.
All right, good. I had to get out of presenter mode, but now people can see it.
Okay, we'll leave that up for a minute, but Andy, thanks again. We appreciate it, and we'll join back with you shortly and get some further updates as we go through this process.
Yeah, there'll be more to know. You know, we will clearly, as everyone knows, safety data is going to be collected daily, and we'll learn more as we go. Efficacy data is going to be collected, so we'll try and keep you updated as we learn more. We don't never know everything, but we'll keep trying to learn more every day.
Well, thanks for all you do, and thanks again, everybody, for joining us. Have a good day, and we'll see you next time.